Mathoth ewi budget no mosom. Kawere gi weche mag budget en ni chwalo kod rito masinde mag thieth e kuonde thieth mag kaontis e bwo chenro moyang kata mano yang kaka Management Equipment Services MES oruchi oko. E chenro manyien piny owacho mamalo kod riwruok mar governors ochopo winjruok ni gibiro tiyo kod chenro manyinge gi yango kaka National Equipment to Counties ne biro bedo ka itelo kod piny owacho mamalo. Ma ne ochopie bang' bura mar ndalo ariyo e boma ma Naivasha. Okang' mane opok kod jakom mar komiti mar thieth mar riwruok mar governors Mudhomi Njoki.
And we are in agreement that now we go and start the rollout of universal health coverage. Finally, we have now executed the IPS, and that moving forward, the noise that has been around on the medical managed equipment services, that has been put to an end.
We are now on a new level where our interest is the service to the people, as long as the national government is providing the equipment. And we are convinced beyond any reasonable doubts that we have done the right decision. That is why we have signed today.
The PCN model has been agreed upon by the COG and the Ministry of Health. However, the financing model will be agreed upon by the two levels of government. The actors is Council of Governors, Ministry of Health and National Treasury. Number 4, there are joint facility assessment to be undertaken across the country to inform the number of primary networks to be established. The actors is the County of Governments and the Ministry of Health. On health financing, number 5, that the National Health Insurance Fund will be reformed to a social health insurance fund through the process of stakeholder engagement. The actors, county governments, Ministry of Health and NHIF.
Piny owacho singo mar keto tenge bilion 20 mar nyiewo